This hypercalcium cow has gone off trail and wandered into a mysterious milky wonderland. She accidentally kicks a bone in the ground, and milk starts to spray. She tries to collect the milk in a 10 tin held by her .5 hand in order to quench her thirst, showing greater than 10.5 milligrams per deciliter calcium. Then, hoping for more milk, she kicks the bone once again and fractures it, and a giant milk geyser goes shooting into the air. And standing there, quite annoyed on a leather jacket for lethargy, is this hiker trying to keep his clogs dry for hypercoagulation. He clogs up his corked con toilet to keep it from filling with milk, showing constipation. And while doing this, he causes a delta symbol to appear on his ECG because, once again, keeping his clogs dry, he steps on a QT heart, causing it to shorten, illustrating QT shortening. For flooding this wonderland with milk, the hypercalcium cow is allowed 0 milk intake, and all of her milk cartons are taken away by this drug bottle with cleats for chelating drugs. This is done by order of the queen, a cow on a throne, for calcitonin, who ordered the drugs to ride in on a biphosphate P. She rules over this land with a laser, fending off missile attacks by Tarzan on a dye rocket, showing Lasix instead of thiazide diuretics. She calls upon her navy, a kidney boat cow captain, for renal calculi, to remove this hiker cow from the land. And fluids are increased for everyone in attempt to wash away the excess calcium caused by the milky geyser.
Represented in this picmonic by the hypercalcified cow is a condition in which the serum calcium concentration is greater than 10.5 milligrams per deciliter, shown by the greater than 10 tin and .5 hand. The normal range for serum calcium concentration in the body is 8.5 to 10.5 milligrams per deciliter, and because this range is narrow, even slight anomalies can lead to physiologic problems. Patients may present with pathologic fractures, represented here as the fractured bone, as excess calcium in the blood is often leached from the bones, weakening them. Furthermore, with hypercalcemia, patients may display lethargy, the leather jacket, as well as hypercoagulation, depicted here by the hiker clogs. Other assessment findings may include constipation, the corked con toilet, and ECG changes, shown as the delta ECG, which may present as QT interval shortening, the QT heart shortened. Cardiovascular changes are the most serious and life-threatening problems of hypercalcemia and should be treated immediately. Interventions for hypercalcemia begin with giving patients no additional calcium intake, the no calcium sign, and administering chelating drugs, the cleats-on drugs, which bind to calcium, thereby lowering serum levels. Other pharmacological interventions include the short-acting drug calcitonin, the cow throne, as well as the longer-acting bisphosphonates, the biphosphate P. For some patients who are volume overloaded, prescribing loop diuretics instead of thiazide diuretics may be helpful, as loop diuretics promote calcium excretion, shown as the loop hen on a dye rocket overpowering Tarzan on a dye rocket. Some considerations to be aware of for patients with hypercalcemia include increased risk for renal calculi, represented by the up arrow risk kidney boat with the cow captain, and to increase fluids, the up arrow fluids. So in short, hypercalcemia is a condition that occurs when total serum calcium concentration is greater than 10.5 milligrams per deciliter. Patients can develop pathologic fractures, lethargy, hypercoagulation, constipation, and ECG changes, such as QT shortening. Interventions include no extra calcium intake, chelating drugs, calcitonin, bisphosphonates, and replacing the use of thiazide diuretics with loop diuretics in hypervolemic patients. Considerations when dealing with hypercalcemia include an increased risk for renal calculi, as well as encouraging patients to increase fluids.